joining us. The purpose of this video is really to explain what is a facelift. I'm a facial plastic surgeon. My name is Edwin Williams. We have an office in New York and a clinic surgical center in Latham, New York in the Virgin Islands. One of the most common questions I get asked is what is a facelift? It's a very confusing terminology because it's evolved over the number of years. I've been doing facelifting surgery for almost 25 years, thousands of patients, and I want to just explain to you a little bit about our philosophy with facial rejuvenation surgery. What I pride myself on doing is not only lifting the tissue, but leaving people looking very natural and much more balanced. For example, some people, as they age, lose a little volume and fat in their face. So the answer isn't just to pull things tight. What it really comes down to is the answer is to balance. Maybe add a little tissue here and reorient some tissue in another direction, so that we customize the procedure to the individual. Some people only have a little bit of jowling. Other people have a heavy neck. So why would you do the exact same procedure on every individual? Some people have a little bit of jowling and a little neck, but they've lost a lot of volume in their face with aging. And so, like I said, we want a very balanced approach that will leave our patients looking very, very natural. Said another way, surgery that's done really well is not seen. We want people to just look great for their age, which will ultimately make them feel a lot better about themselves. So I've explained to you a little bit about our philosophy and how I try to use a balanced, customized approach. I explain this to the patient when we meet in consultation. And Susan Sullivan, who's been with me, she's a registered nurse for almost 20 years, is going to explain the difference between what I refer to as a weekend lift and the type of lift that involves the mid-face and the lower face liposuction. So I hope this answers some of your questions. We look forward to meeting you.
Hi, my name is Susan Sullivan. I'm a registered nurse and I work with Dr. Williams. I've been with Dr. Williams for about 18 years now, and I typically see his consultations before he sees the patient. During this process, I always hear the same thing from patients when they come in and they don't like their neck or their jawline, and they'll say, but I don't want a facelift. The reality is the word facelift actually always referred to a surgical procedure that addressed the jawline and the neckline. But today, as we move forward in plastic surgery, we're now doing a brow lift, a mid-face lift, a jawline lift, and or a neck lift. So my goal is to explain the difference and how we handle it here in our practice. So when patients come in and say they don't like their jawline, and if they put their fingers in front of their ears, then they get a nice improvement in their jawline, we refer to that as the weekend lift. And the reason why we refer to it as the weekend lift, because it takes a couple of days of laying around. The incision line is shorter. It starts along just above the ear, comes along the hard part of the ear and just underneath the earlobe. When patients come in and they say that they have a little bit of excess tissue on their neck, Dr. Williams does what he calls an extended weekend lift. Extended meaning the incision line gets a little bit longer. So it starts in the same area, it comes along the bottom part of the ear and right up and back of the ear. And through that he's able to not only get the jawline lifted, but a little bit of the tissue on the neck. When patients come in and they say they want a neck lift done, or they don't like their neck, he does what he calls a weekend neck lift. And that is where incisions start in the hairline again, follow the same exact route right up and back of the ear, only he extends it into the hairline. So with each procedure, the weekend lift, the weekend neck lift, the incisions get a little bit longer and the healing time is a little bit longer. Some patients who have a lot of excess tissue on their neck would require a little bit more in their procedure, where he extends the incision, starts it more up all around the temple in the hairline, coming down along the hard part of the ear, right up and back of the ear and into the hairline. And with this, he does a mid-face lift. So this patient would require a mid-face lift, the weekend lift, and the neck lift to achieve that real natural look that Dr. Williams always tries to give to all of his patients. I hope that this helps you understand the word facelift when you're looking for the right procedure for you. Thank you.